Last year, at around this time, we were all haunted as a nation. These were the images that haunted us from cremation grounds, graveyards, and mortuaries inside hospitals. The World Health Organization now says that 4.7 million Indians have died from COVID, 10 times more than the official number. But the government has gone to battle against the WHO over these figures. What is the truth? Are we going to leave our citizens, hundreds of thousands of them, uncounted?
We can disagree on the numbers, but there's no dispute to the fact that there is a mismatch between the official toll and the actual toll. The question is, how wide is that gap? Let's introduce our guests on the program today. We're joined on the program by Jagjot. Jagjot is somebody, let's welcome him to the program. Jagjot lost his mother to COVID, and his mother died from a shortage of oxygen in one of the premier hospitals, private hospitals in the capital. And yet, his mother is among those whose death has not been acknowledged. Remember, Parliament was informed that there has not been a single oxygen shortage related death reported by any of the states. We're also joined by Dr. Swapneil Parikh, who's, of course, a physician and author, and someone who has been studying the numbers very, very closely, and we'll talk to Swapneil in a while. It's also my great pleasure to welcome to the program Rukmini. Rukmini is a data journalist and an author and somebody who's done stellar, invaluable work actually first looking at the excess mortality through the pandemic years. So welcome to the program, Rukmini. Somebody with a very different perspective who has done a study of his own that has been much talked about in the media is Professor Manindra Agrawal, I beg your pardon, from IIT Kanpur. Welcome to the program, Professor Agrawal. Thank you so much. And we're also joined by Dr. Ishwar Gilada, who stands between two stools, who acknowledges that there's been an undercounting, but believes that the WHO report is completely anti-India, and he'll explain why. So welcome everybody, and I'd like to start with Jagjot. Jagjot, because I met you when you were running from pillar to post trying to get justice for your mother. Your mother was admitted at a private hospital in Delhi. This was not the only hospital that ran short of oxygen, and since then you are among the families who've been fighting for justice for her. Can you first tell us where does that fight for justice stand? What happened with your mother, and what's happened since then?
Okay, thanks, Barkha. Obviously, when we recall our time exactly 1 year back, we were just fighting for, first of all, the life for our mother. There was shortage of medicines and things like that. But eventually, doing all our effort, we lost our mother to an incident which has not been reported yet. We lost our mother because of lack of oxygen in the hospital. Uh, After that, I think we tried our best to reach out to several authorities just to check and then just to get it recorded somewhere that she lost her life due to lack of oxygen instead of just calling it as a natural death. And today also, when I was just looking at the death certificate of my mother, it says like a natural death, not even a mention of a COVID on the death certificate. Forget about mentioning about lack of oxygen over there. And the fight for justice, it's still on from our side, but I know it's difficult to get justice in India. We all know about that, but we are still hopeful that somewhere someone will acknowledge or at least try to find out the real reason of death of all those who lost a life in a single night. Approximately 23 people just died in an ICU in a single night. How that could be possible, whether that was negligence or lack of oxygen. So
And and and
yeah,
and, and of course, I'm extremely sorry, and we all are for your loss. And thank you for having even then the courage and the openness to come and share what you must be going through right now. Can I ask you though, to be very clear, your mother was admitted for COVID in this hospital, correct?
correct.
And when she was released, and I would like to show everybody the death certificate that Jagjot's mother that was given. This is the death certificate. And the manner of death, it says natural death, right? So it doesn't say COVID. It doesn't say oxygen shortage. It simply says manner of death, natural death. And in my opinion, this is a clear, very, very clear and visible example of how people fell through the cracks. So, Jagjot, when you see this dispute over the WHO report on the one hand and the official tally on the other, people like your mother were not counted. We've demonstrated it. What would you like to say to those who believe that this is an attempt to slander India and so on?
So my advice will be, first of all, if someone has found something, even though that's a mathematical calculation, let's acknowledge that. Let's try to find out the complete thing. And if we say that we have a correct data with us, we should come up with the methodology and clear figures for that as well. If there is a disconnect, that will be clearly visible. There are like statisticians, there are like experts who can easily make out that whether the death being reported by the government is correct or where it is lesser than what it actually should be. So I think definitely there is a disconnect. Though I'm not that expert to calculate, give you the right figure, but somewhere obviously the death toll reported by government does not feel correct to me, because we were at these sites, we were at the during the time when we went to funeral, lakhs, thousands of deaths, hundreds of people were like cremated at a single time, and out of those people only hardly anyone was coming from the hospital, rather people were coming from the home where
Yes.
that data was being reported. So
And you are a living example. Again, to be clear, Jaipur Golden Hospital, where your mother was admitted, actually went on record to say that there was a shortage of oxygen. Your mother was admitted for COVID, and the death certificate granted to you says cause of death natural. As a son today, how do you deal with the fact that your mother is not even counted today among India's COVID deaths?
So it's very disappointing. I cannot even explain in words, but it's disappointing whenever I connect with the other people also who died during that night. It's we feel like that in India we are not sensitive about these issues. So that's the first thing which comes to us, which comes to our mind. But what more we can do? We have our fight on. We are fighting for the justice. We want this to be reported, and needless to say, but the people, the government, everyone is so insensitive that in parliament also they are saying and commenting that not a single person died because of lack of oxygen, because they don't have the data. At one point they say they don't have the data, and other time they say that the data we have is it's 100% correct. So again, that's contradictory statement from the government itself. So as a victim, I feel very disappointed that the kind of mess we went through, and after that also we are not learning. Maybe this data will be helpful for the future generation. Let's acknowledge, let's try to get the right facts for everyone together.
Yeah. And thank you for your composure. I think in your place, I would be a lot more agitated, a lot more anguished, to even have to deal with that death certificate that says that the cause of your mother's death was natural. I want to open this up for responses, though, because many people have been asking me again and again, where is your evidence? Where is your proof that not all people were counted? And I thought we should start with the one very, very clear category of people who have not been counted, those who were admitted from COVID and died because the hospitals ran short of oxygen. The center asked the states for feedback. Not one state came back with a confirmed case of an oxygen shortage death, despite the fact that all of these hospitals are on record saying that the hospital that in their ICUs, oxygen had run out. Dr. Gilada, I'd like to bring you in now, and then Professor Agrawal and Swapneil and Rukmini, because you have been arguing that the WHO report is all skewed. I don't know. You guys are the experts, all of you, in mathematical modeling, in data crunching. I only know that I met literally thousands of people like Jagjot over the last 2 years who, for one or the other reason, were not counted. What would you say? Let's start with the first category of the oxygen shortage deaths that have not been documented, and then put that into the larger context of the debate over the actual number of dead.
Thank you very much for having me on the show again. I would like to deal with what Jagjot said. Cause of death as a shortage of oxygen or hypoxia, it is not part of medical certification of cause of death, not in India, not internationally, anywhere. So, and secondly, the government of India inform all the states, please do not write hypoxia or shortage of breath or shortage of oxygen as cause of death. So if you write an advisory to the states, you do not expect that they will put oxygen shortage as cause of death. So cause of death has to be certified differently. What is the real cause of death? So oxygen shortage, water shortage, medical shortage, medicine shortage, that is never a cause of death. Now, secondly, let us talk about our weakness. Yes, we are weak in something, we are strong in something. Almost 92% of the estimated deaths are registered in the country, in all the states, even poorest of the poor states and worst of the worst states. But the problem is on the registration certified death, like medical certification of cause of death, and that is only 25% till 2019. They are now toning up that, and that might have reached around 30%, 35%, but it is not 100%, it is not even 50%. That is our major problem. Second problem is, yes, additional death happened, not only in India, all over the world.
Of
What
course.
WHO is saying, yeah,
Yes. Okay.
yeah. So what WHO is saying, that all over the world, 9 million extra deaths happen, out of which half are in India. And that is a clear-cut discrimination and sidelining India and showing India in a bad light. And the kind of connotation they use, they are really, any intergovernmental agency should not have done that. Secondly, they have sidelined only four countries. India, before India is Russia, 3 times more death. I think Indonesia, 6 times more death. India, 9 times more death. And Egypt, 11 times more death. And all over the world, it is 1 time, 2 times only. And in US, they shown 0.93 time deaths. That means they are showing less death happened than the US has reported.
Okay.
So I think this kind of reporting itself is a putting WHO in a bad light, and WHO is not a credible agency anymore now. You have seen what China has done today to WHO.
And I would say with humility that I don't particularly as an Indian care about what WHO says, but I do care that my fellow citizens who lost their loved ones should be acknowledged. We keep saying people aren't only numbers, Dr. Swapneil Parikh, but here we are dealing with a very ironic situation where we're saying they're not even numbers. Dr. Gilada explained why Jagjot's mother would not have been counted among the COVID death tally, but the fact is she was admitted for treatment for COVID. And that treatment failed because the health system was snowed under and the oxygen supply ran short. How is the cause of her death natural? Dr. Swapneil.
Hi, Barkha. I'd like to point out that that as a medical legal document, that death certificate is incorrect. You cannot write a cause of death as natural death. You have to actually write what the person died of. So it might be pneumonia, it might be septicemia, it might be something like that. It's not natural death. Now, it's possible that someone died of pneumonia and a diagnostic test nor clinical criteria for COVID-19 were applied. So you can't say COVID-19 pneumonia, but even that's a stretch, considering that it happened in a hospital and the hospital said this was a case of COVID-19. So even if there was not an antigen test done or a molecular test done for COVID-19, clinically, the doctors, based on the information I have right now that you shared, said this was COVID-19. It may have been pneumonia. It may have been another COVID-19.
I mean, we can ask Jagjyot that. Jagjyot, was an RT-PCR test done in a hospital that confirmed that your mother had COVID, or did you take her for COVID-like symptoms? Jagjyot, if you just like to clarify that.
Yeah, obviously, our treatment started when we showed them the RT-PCR test report to the hospital. Then only they started the treatment related to the COVID to our mother.
Okay, so, I just wanted to clarify that. Swapneil, go ahead. Yes.
Yeah, so this is a completely incorrectly filled death certificate. So this isn't right. Even if it wasn't COVID-19, this isn't right. And we're taught this in medical school, that this is not how you are actually supposed to fill, a death certificate. So regardless of what the cause is, this is wrong. And this is actually just a great, and this is not the only place that this happens. This doesn't just happen in COVID-19. This is a very common occurrence. And actually this highlights how fragile our health data recording system is. That forget that we aren't classifying it as a COVID-19 death. We're not even following the correct procedures in filling out this death certificate. This happens all the time, and it has huge consequences at the national level because our data is incorrect, but also for the individual, as we're seeing here, who does not have closure, who feels almost gaslit to a certain extent. And it can have consequences in terms of insurance claims. It can have consequences in terms of compensation. Now, Barkha, but this brings us to an actual important thing. Why is it important to have an accurate count of the people who died? Is this an academic question for academicians, or is it a clinical question for health workers? Is it to count those who perished? Is it to recognize the pain of the families who were left heartbroken? Is it for insurance claims? Is it for compensation? Or is it to identify the inadequacies in our systems so that we can begin to improve them, make them more robust, so that we are better prepared for the next wave and the next pandemic? And there will certainly be a next pandemic.
And can I answer some of those questions and then come to Professor Agrawal and Rukmini? I think the question is also a moral one. It's a public health principle, right? You do not count those who have died, and that's where. Of course, everything you mentioned, compensation, the very poor have struggled in particular to get a death certificate. If we come out of these pictures now and we go to Professor Agrawal, sir, your study argued something quite different. You've also done extensive work in UP as a professor at the IIT. Please share your responses both to the WHO debate and what you've heard from a case like Jagjot's.
Yeah, so I think that firstly I would like to echo you that I don't really care much about WHO report. But at the same time, since it's a respected organization across the world, so what it says carries a lot of traction. And therefore, if what they say is incorrect, it needs to be properly scientifically countered. So that will be my first perspective to this. At the same time, while I counter WHO's numbers, I do not, in any case, have support the idea that the reported numbers were the actual number of deaths due to COVID. They were much more. That's very clear. I think, and the data, and I do not base my conclusions based on anecdotal evidence, because my perspective is always to use data. So even the CRS 2020 data does show up. Even during first wave, the number of COVID deaths were likely to be more, significantly more than the reported ones. So let me take the WHO report first. So since whenever you have lack of data, you create a mathematical model. That's what WHO did in order to project or predict or estimate the number of deaths. Now, in any model, you make certain assumptions. And it's on those assumptions, your model can stand or fall, the correctness of those assumptions. Now, one of the key assumptions that WHO model made, and they put out an explanation on the website, which is available for everyone to see. And the assumption is the following. Take any month of the COVID pandemic and take, let's say, country, India. In that month, let's say May 2021, the peak of the pandemic, take the number of unreported deaths and divide it by the total number of deaths. So that's a fraction. And the assumption made is that this fraction is same across the entire period of the pandemic. Their entire calculation is based on this assumption, and they explicitly say if this assumption is not true, then their calculations are not correct.
Okay.
Now I pose this question to all of you. Do you think that assumption is correct? My view is certainly not.
Okay.
At the peak of this pandemic, this assumption that the fraction of unreported death would be significantly more than most of the other period of the pandemic.
Can I ask you, though, you opened by saying, Professor Agrawal, that you do believe that there is a gap between the official data and the actual data. And of course, several states are still reconciling their mortality figures. Is there any information we have right now at how big this gap may be. One of the suggestions that has come from epidemiologists is that perhaps this question needs to be asked of families in the upcoming census. That maybe that is our way to lead a more transparent conversation over how many people actually died. Would that be a measure that you would support, Professor Agrawal?
That would be definitely a very good idea. Consensus is due anytime, so it will be a good idea to make that as one of the questions. In any case, we do have CRS data available for 2020, which allows us to make a good estimate of the excess mortality, at least in the year 2020.
I'd like to take this to Rukmini because she did a lot of work on the excess mortality. Now, Rukmini, one of the intriguing things about the WHO data is that when it talks about the excess deaths, it's actually not making the case that this is all-cause mortality, which is death from any cause. Their press statement clearly says that these uncounted deaths, these overlooked deaths, they believe are all pandemic associated. I just want to be very technically correct. So, for instance, for example, deaths from tuberculosis or cancer or kidney disease that could not get medical help because hospitals were snowed under, oxygen shortage deaths, lockdown related deaths, pandemic associated. They're not actually making the point about all cause mortality, which is what you studied, and then you made a deduction about the factors that may separate the official from the real. How do you see, Rukmini, this current debate raging between the government and the WHO?
Thanks very much, Barkha. And I, want to start by sharing my condolences with Jagjyot ji, because essentially, in a sense, this is what statistics are, which is a way of counting every person and an attempt to give people dignity both in life and in death. The reason I believe in statistics and their power is because they do provide some sort of acknowledgement and closure to people, although none of it goes far enough. I do think that a good starting point is acknowledging that we did miss a lot of COVID deaths. And the reason that we believe India missed a lot of COVID deaths has nothing to do with which side of the political spectrum you stand on or what you think of this government. It has to do with, one, an acknowledgement of our past ability to count both diseases and deaths, and the acknowledgement that we have missed many deaths in the past from other diseases, including malaria as well. We did go into the pandemic with 92% registration of deaths, as Dr. Gilada mentioned, but Bihar was registering 5 out of every 10 deaths. And to assume that in a condition, a situation where administrative systems were so overwhelmed, as we know they were, to assume that every death was being registered is a leap of faith, or sort of touching faith in our administrative capacities that I would not take. So essentially what estimates by various others, including the WHO, are doing is to try and look at what deaths from all causes would look like if there hadn't been a pandemic, and what they have looked like during the pandemic. The WHO then takes the next step of making assumptions about what share of those could be ascribed to pandemic-related causes, which is something that not all estimates, not everyone attempts. I also just want to add that the more that we sort of mystify mathematical modeling, particularly that used by the WHO, the more we make it seem like some sort of voodoo mathematics that has nothing to do with real life. And I just want to make very clear that the WHO's estimates are not a product of mathematical modeling. They are based on data collected by Indian journalists and researchers from 18 states and union territories, which is CRS data from government websites. However, since this data was not provided by the government and was not made available for all states, there has been extrapolation based on past estimates of how mortality functions in India. Again, not outlandish claims, to estimate what mortality for the whole country would look like. Let me say, these are not perfect. Neither the CRS numbers derived by journalists nor these assumptions are going to be perfect. But this is what the WHO has done, and I just want to sort of demystify it to not make it seem like something worked out on a spreadsheet.
So can I ask you, before I get more comments briefly, Rukmini, you don't think the WHO is indulging in voodoo mathematics? You don't think it's inherently biased, as Dr. Gilada thinks? We all seem to agree on this panel that there are Indians who haven't been counted. Do you believe with the scale and the magnitude of that gap as the WHO is suggesting?
I do, because this belief is based on what estimates from not just the WHO, but at least 3 other studies, including one published in Science magazine, arrive on. And these use not just the database that the WHO has relied on, which, as I would like to restate, comes from data collected from the CRS by Indian journalists and is not a model. In addition, it uses representative household surveys, including those by CVOTA and CMIE. These all land on roughly the same number, which is roughly 4 million for 2 years. So it's not a question of belief, it's a question of what available evidence points to.
Okay, now I want to do one thing, and then I want to come back to all of you, starting with you, Swapneil. I'm just going to show you little postcards from my own travels of families that I met who weren't counted, and the reasons were different. Let's start with Vikas Singh from Madhya Pradesh. He was an auto rickshaw driver. He could neither get an RT-PCR test nor admission to a hospital. He went to 6 different hospitals. His wife was with him, Jyoti, and she told us that he eventually died in the auto rickshaw that he used to drive to earn a living. He was not counted. Let's take you to another uncounted family. This is from Rajasthan. This is Ram Avtar Singh. Ram Avtar Singh, single father to 2 small children. His wife Santosh died from COVID. In his death certificate, it doesn't say natural, it simply skips the cause. The column in that death certificate is empty. So that is another thing that a lot of families encountered. Here is Tamil Nadu. Rudresh was a house painter. He died in an ambulance on the national highway between Bangalore and his native village of Hosur in Tamil Nadu. His sister Shobha told us they have zero documentation to be able to get a death certificate that will say he died from COVID. Now let's go to the next. Sherchand. This is heartbreaking. His wife was in the same hospital as Jagjot's mother. She too died, Manju, from oxygen shortage in that hospital. He's a single father to 3 children. Once again, there is no acknowledgement. She was admitted for COVID. She was tested for COVID. That death is unacknowledged. Then let's bring up the next uncounted example we have. Ram Gopal Verma lost 2 family members. He's in a village, lives in a village in the Varanasi constituency of Uttar Pradesh. Because at that time, a lot of local doctors were the ones who were addressing these patients. Pneumonia was the most commonly written cause instead of COVID, and he was never able to get documentation that proved a COVID death. And finally, these are other causes from which people died, but they died because they couldn't get medical help. This is just one example of a family where the tea vendor father to 5 girls died from tuberculosis. He could never get an ambulance or medical attention because the hospitals were completely snowed under by, in fact, COVID. And last but not least, and I know Professor Agrawal will disagree, he has done a study which says that the bodies that were found along the banks of the Ganga did not point to a mass scale abandonment, and we'll ask him to talk about that later. But every single eyewitness that we interviewed along that riverbank spoke about a surge of bodies that were being left in the cover of night, either because people did not have money for firewood or because there was stigma associated with these bodies. I'd like to start with you, Swapneil, and get reactions all around. Swapneil, these are just examples. I'm sure all of you as doctors and medical workers and researchers at the front line saw your own examples. Go ahead. Do you agree with Rukmini that the scale makes sense? Or do you agree with Dr. Gilada and Professor Agrawal that there's a gap, but the gap pointed to by the WHO is outlandish?
No, I would say I'm closer in agreement to Rukmini, but we're never going to know what the actual number is. And I think the WHO has been upfront in saying that this is an estimate and there are limitations to their work. It's not like they have some ulterior motives or trying to hoodwink everyone and saying this is an absolute number. There are uncertainties. We should acknowledge those uncertainties. We're perhaps never going to know. But the deaths due to COVID-19 are far in excess, several fold in excess of the recorded deaths. If I can, I just want to pose a simple question, Barkha. Are we as Indians, for some unknown, ununderstandable reason that no scientists studying COVID have understood, exceptionally good at surviving COVID-19? Is our healthcare system, did we have some miraculous treatment for COVID-19 that no other health system had? Or is it just possible that our systems that are already not so great at recording mortalities suffered as many inaccuracies as our health systems, been counting the death as our health systems in caring for the sick. And what happens in other health conditions? What happens in TB, malaria, HIV/AIDS, dengue, childhood diarrhea, childhood pneumonia, antimicrobial resistance, malnutrition, diabetes? You pick the disease. Are we exceptionally good at treating those in India? Or are we breaking records in mortalities there as well? These are important questions we need to ask. I think, if I could just sum up with something, and it's an article I recommend everyone reads. It was in the Hindu. It was written by Ashish Gupta and Murad Banaji. The bitter dispute over India's pandemic mortality. And it ends with this question. It ends with this. Ultimately, the rift is not about science, data, or methodology. The basic question is whether we wish to pursue the truth or not. This is something that I think about a lot. The painful and bitter truths soothed by the balm of self-improvement, that's preferable to the proverbial bliss of ignorance. And until we actually acknowledge these numbers, we can't fix the systems.
And I would agree with you that it all boils down to the willingness to seek the truth. Professor Agrawal, if I can bring you in, one of the sort of most dramatic and disturbing images were, of course, those sort of shallow graves along the Ganga, and the IIT study suggested that these were traditional systems, and of course, some of them were. Children have long been buried, young brides have long been buried instead of being cremated, but multiple witnesses that we met actually suggested this to be a phenomenon of the surge. We ourselves saw bodies that had been retrieved from the river into which they had in fact been thrown in certain cases. So I'd like you to come in on what Swapneil has said on the willingness to find the truth. What is the best way for us as a country to offer justice and some healing to people like Jagjot?
It's very easy to say that we are interested in finding the truth. But the hard part really is to make that effort. And I'm a little disappointed that some of our panelists who are supporting WHO's report have not even read that report in detail. Because it is not a question of, as Dr. Parikh said, is India exceptional? But the question really is India uniquely worse than anybody else? For example, the same WHO report concludes that Pakistan had about 50 deaths, excess deaths per 1 lakh. Bangladesh has also had around 50 deaths per 1 lakh. Nepal, Afghanistan, they all had around 50 deaths per 1 lakh during the pandemic period. India had 170 deaths per 1 lakh. How the hell do you justify this? Is India so terribly bad than Afghanistan and Pakistan and Bangladesh and Nepal? Is our health system so very messed up? This is the question that needs to be answered.
I think that's a fair question. I'll bring in Rukmini and then Dr. Gilada on this and give the last word to Jagjot. Rukmini, do go ahead. That the question is not, were we exceptional? I think that exceptionalism was challenged in any case by the second wave. The question is what the WHO report, Professor Agrawal argues, says about all the other countries. Dr. Gilada makes the same point, implying bias.
So here's the point that I feel actually doesn't get enough attention, that while India, is the country that reports the highest excess mortality in the WHO's numbers, proportionate to population, India's excess mortality is 33rd among countries. And, that would make essentially no headline if that appeared the next day. Peru is the highest, for example. So I wish, there was an ability to step back from a desire to show that India has done so much better than any other country, because what it would do is place India at not much worse or better than any other country. 33rd would not make a front page headline even the next day. So I do not think it places India as having done exceptionally worse than any other country. It places India at a position where the data sort of seems to back up what reporting showed. And I just want to add one more thing. I commend you on the examples that you pulled up right now. And in a way, they illustrate exactly what the WHO uses to describe why it believes that some deaths were missed from COVID. It lists these reasons as having been those who died without testing or contingent on the country correctly defining COVID as the cause of death, or they miss the increases in other deaths that are related to the pandemic, leading to overwhelmed health systems. This is essentially exactly describes the examples you pulled up, and sort of reaffirms my sense that the direction of the methodology and the direction of the WHO's estimates are rational and born in sensible thinking.
Thanks for that. Dr. Gilada, to Rukmini's point that there isn't bias, that if you do it on a relative proportional scale, there isn't bias, you would say what?
There is a definite bias. Broadly speaking, the narratives WHO mentions are totally wrong. If
But
India is
address the point she made about the proportionality to the population.
No, that's what I'm coming to. So when you talk about proportionality of population, when you have a table, you cannot put by population. You put by per million. How many cases per million? How many deaths per million? How many tests per million? And where is India ranking there? So WHO since beginning, or even a lot of other bodies since beginning, has been saying which is number one country, number two country, number three country. So India being number two in population will be number two, number three, number four in many problems, whether health problem or other problems. Now, secondly, if India's total death in 2019 were 9 million, India's COVID-related death recorded in 2020 were 1.1 lakh. So they are only 25% of 23% of total COVID deaths. In 2021, there were more deaths. You cannot extrapolate 23 or 21 deaths for the entire 2 years.
Okay, Dr. Gilada, can I ask you this? Sorry, because I'm at the end and I want to give Jagjot the last word. Do we and can we all agree that the census going forward, because what will happen is that tragedies will be lost in this very, very high voltage debate, which is now a very political and politicized debate. Should we at least show the willingness to find out more and deliver closure, as much as closure is possible, to families such as those of Jagjot? Professor Agrawal agreed with asking the question in the census. Rukmini, do you agree with that? Is that one way ahead? And then Dr. Gilada, and I'll give the last word to Jagjot. Is the census a way forward?
It's an additional way forward, but it's not the only way, and we don't have to wait for it.
Okay, Dr. Gilada, quickly, sir. I'm out of time.
Barkha, already the courts have done some job for providing compensation to those people who are not counted. So they had taken additional features in count, doctor certification, X-ray, CT scan, or clinical findings, and they added those deaths. That is one way. Number two, census, yes. So if you can take average of 2, or you can just go by census after some time, that's fine. But you cannot go by what WHO is saying currently, 9 times more in India and only 1 time. Or
I just think for our own sake, forget WHO, as I said in the beginning. We need to go back to the certification which shows, and I say forget WHO because I'm not equipped enough or skilled enough to argue with experts such as all of you on the numbers. That's why I say forget WHO. I only know that death certificates that I have witnessed, either as in Jagjot's case, show cause of death is natural, or in Ram Avtar's case, have the column empty. And in some states, there was actually an order to district officials to leave that cause of death empty. Jagjot, I'd like to give you the last word. You are not an expert. I'm not an expert. You're speaking here as a son who's lost his mother, who is not counted in India's tally at the moment, and you're trying to file an FIR, I know, against what happened. You have not succeeded. None of the families have. Your last thoughts today as a son. Sorry, you're on mute, Jagjot. Can you unmute yourself? Yes.
Yep. So as a son, obviously, I will fight till the end, till we get this data reported on whatever the forum or platform we can go. So government or authorities or anyone can get complacent about that, but as a son, I will never sit and accept the fact that nothing happened to my mother and she just died naturally. So that's totally wrong. So if I'll get succeeded in getting it reported as COVID or as a death because of oxygen, which is actually the fact, I will believe I'm contributing to the data, the correct data that the government should have it. So that's the moral responsibility as a son for me, to get that reported correctly in the records, and that's what I'll attempt for.
And more power to you. I think none of us would hesitate in saying that we hope you're able to get that justice, because it won't bring your mother back, but it'll give you some sense that you did everything that you could to at least have her death acknowledged. We leave it there. There's going to be a lot to unpack in the coming days and weeks, and we'll have some of you back. Thank you very much to all of you, and Jagjot in particular, our gratitude to you for coming at such a time and sharing what is, of course, always a point of pain to talk about. Thank you very much. Take care. Bye-bye.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalists.